everybody. Thank you for coming out so early. This is early for me, sorry. I want to welcome you to our seminar this morning that is being jointly sponsored by our Clinical and Translational Science Collaborative and the Prevention of System for Healthy Neighborhoods. I'm Maritza. I'm the lead of our community and collaboration component of the CTSA, as well as the director of our PRC. And so I think that the exciting part about a lot of this is that in this new 5-year cycle of we're 6 months into the new 5-year cycle for the CTSA, and some things have really changed significantly since the last 10 or so years of doing this. And this time there's a significant focus on not just team science and the development of effective teams and research teams, but teams that also involve external stakeholders. And so when you think of external stakeholders in the research process, based on wherever you are in your own research itself, who are the folks that potentially translate or would uptake the work in which you do? So basic scientists, it might be the industry folks, the clinical scientists, it may be patient advocacy groups, it may be clinics and hospitals, in public health and community science, it may be community organizations or the residents themselves. So this is where our focus is going to be for the next 5 years. I also want to just say that I think there's going to be, hopefully there will be an orientation towards reaching out if you're on teams. This is going to be the beginning of resources and support for teams through the CTSA. And as a clarification of this, is that how many of you think that the CTSA is something you have to be a member in? Oh, good. Okay. So, because the CTSA is a resource. It's a resource to all of you, right? And so we want this to understand that you need to reach to us in our area. It is in the team science component. How many of you currently work on interdisciplinary teams? You can say, okay. How many of you would like to learn more about being a more effective team? Yes, we all. So this is our beginning. We have had the great pleasure to have the last 2 days with Dr. Maritza Salazar Campo, who's here from the University of California, Irvine, who is a national expert in team science. I think those of us who are spending time with you, yesterday she worked with 8 teams, 8 really different teams across our institutions, and the buzz in the room was just powerful. So we thank you for bringing that energy, and today she's going to talk to us about the science of team science, based on her work of working with over 100 research teams across the country. So I think you'll tell a little bit more about yourself, but welcome and thanks for coming.
Thank you so much. All right, so it's great for me to see how many of you are engaged in teams. I think I'll make the case today that it's very rare that we find ourselves alone in a desk or a cubicle or at a bench, working all alone. And most importantly, what I've learned about Case Western over the last 2 days is this legacy of trying to produce knowledge and make sure that it makes it out to clinical populations. I've also learned more about broader Cleveland and some of the health and community challenges that your institution, I think as an academic institution, has to be really cognizant of and armed to do something for people in the local area. And in some ways, what I'm going to show you is my fundamental belief that if we can organize more effectively, we can get better work done, right? I don't think there's a single one of you who decided to enter into this profession to not make an impact and to do the kind of work, whether it's around, I know you've had some really great victories around cystic fibrosis. I know that nationally there's been a lot of progress in a number of different diseases. But again, this team approach is the way to go, I believe. So I'm going to present some work that was funded by the National Science Foundation around a concept and a construct that is new to my field. A little bit of background about me. I am a professor of management and organizational behavior, meaning I'm at a business school. Most of the time, my primary teaching audience, when I'm at work, are MBAs and executives. When I teach, the companies I interface with include everyone from Johnson & Johnson, Coca-Cola, right, Exxon, PricewaterhouseCoopers. I do a lot of work on the corporate side. The other half of my career is really heavily focused on biomedical science, biomedical work. I am, as you can see, the director of team science both for UCLA's CTSA and UC Irvine CTSA, right there again, those are the Clinical Translational Science Awards. Both of these institutions, if you've seen the, if any of you are secretly fans of the Housewives of Orange County, right, you know that they're really different demographics, right? Orange County, we do have a different community. There are populations of Latinos and Vietnamese that are really unique. At UCLA, when we're thinking about team science, it involves neighborhoods like East Los Angeles, South Central, and other populations, right? And so I've gotten the chance to see what teaming looks like across a number of different institutional environments. I have a PhD from the Stern School of Business, and I have a master's in social work from the University of Southern California. Why that's important is because the way I think about a team is very much from a systems view, in that we are interconnected, we are mutually dependent on one another, and this really comes to light when we think about scientific teams. My journey to this point has involved a lot of participant observation in lab meetings, in clinical hospitals, in labor and delivery wards, right? I just did a team science reboot at UC Irvine's Health where we went from department to department to department, thinking about how to get interprofessional teams to work more effectively with simple things like handoffs and whatnot, right? But all that to say that I hope that this talk resonates with you as much as possible. So first I thought I would do some initial definitional work. And again, some of you have seen the presentations over the last few days. I apologize if this is a repeat. So team science includes research projects and programs that are focused on some phenomenon of interest, right? Some research problem. It is important when you think about bringing people together that the glue be some complex problem for which a solution could not be achieved if you didn't bring together the right experts. Now, it can be the case that teams can be from the same discipline, but even from the same discipline in healthcare, it doesn't mean that we're all using the exact same tools, right? We can be thinking about the same chronic disease or the same disease, whatever the disease might be, and some might be thinking about it from a very, very basic science perspective, thinking about it from the cellular, genetic, mouse model type of approaches, and some are thinking about the disease as a lived experience, right? You're qualitatively studying what it means to be a cancer survivor day in and day out, or what it's like to live with whatever debilitating disease, or you're thinking at it at the population level, doing epidemiology, and have a completely different lens in the problem. Technically, your degrees all say we're in the same department, in the same discipline, but those different levels of analysis and the different frameworks for understanding the problem and the way you ask a question, even within the same department, can create these challenges, right, to collaboration. Adding on to the complexity, when we say, well, this particular disease requires that we cross the disciplinary boundaries, it's going to mean a couple of things. It might mean, especially as I'm noticing on this campus, we have departments that are distributed across the campus. It means you have to get on your coat, you got to walk, or you got to drive to some other campus, right? Some other department, and say, let's work on this problem. There are other challenges that come as we work across completely different disciplines. Inherent in that are some other challenges, right? If I say, okay, I'm a nurse and I'm making, let's say Shirley or Darcy can give me a better answer. Maybe it's $100K an hour to be a nurse, $100K a year to be a nurse. And I'm on the same team with a radiologist that's making $450,000, right? We have incentives and motivations that are really different about why we want to work on the same problem. We have cultures that say this is valuable work or this isn't valuable work across our different departments. It can get very, very, very challenging. But in any case, team science can be either within discipline, across discipline, and it does not only have to mean that you're bringing together just different ways of thinking from a disciplinary perspective. The more I have been doing this work and I've traveled across a number of at least American academic institutions, I have seen community partners at the research conversation. I have seen corporations and tech transfer folks at the table. Expertise comes in a lot of different forms. I've seen parents who are parent advocates saying this is what the disease means for me and my family, and make sure you're taking these issues into consideration. So if you don't believe me that people are working more in teams, here's a review of research articles, about 20 million over the last couple of decades. And you can see that across all fields, science and engineering, social sciences, people are working in teams of at least 2 or more. 3 or more, technically. But the flat line you do see is that of the arts and humanities, right? Where it's not the case that in every field people are working in teams. When people work with others, they tend to produce work that is more impactful than when they work all alone. That being said, arriving at that impactful work is not for the faint of heart, right? As many of you know, since I saw so many hands in the air, collaboration means finding a common language, trying to find a problem that's mutually engaging, figuring out how to coordinate. And that can be coordination in terms of, hey, what time are we going to meet given your crazy clinical schedule and my schedule? Where will we manage that? It can mean, look, I'm working with big data and you're working with specimens. How do we coordinate our data? It can mean my IRB at Case is different than your IRB at Cleveland Clinic. How do we make sure our even intake process matches as we're trying to do some clinical work? Coordination is incredibly challenging. This study here by Jonathan Cummings and Sarah Kiesler suggests that they look at a series of 500 NSF-funded proposals that produce, each of those different projects produce knowledge outcomes or outputs, papers, products, patents. And they say, look, we want to look at how the composition of these research teams affects their ability to produce these knowledge outcomes. And what they find is when these teams have more disciplinary diversity in the team composition, teams produce fewer of those knowledge outcomes. Similarly, when there's representation from more universities, they also face great barriers to producing work. Now, it is the case, they've done some work longitudinally. It is the case that with more time, the work does begin to produce, but still the negative slope remains, right? And so I put this slide up because I often face resistance from academic faculty, especially in medicine. And they say, I've been in a lab since I was 21. I've been teaming. Because I've been in a team, I know how to do it, right? And this data, and I can show you other data as well, suggests actually we have a couple of notable wins. Mapping DNA to the human DNA. Here it seems like we have a couple of wins on a couple of diseases, but they're rare. And we hang on to those and we have a halo effect and assume, but we must be good at it. This data says actually very few of us are, right? Now, when I go and I do this work, I often explain it to faculty and I say, look, I'm taking your technical expertise, having learned how to do what you know how to do, and coupling it with other knowledge, right? Project management, leadership, any kind of other functional skill that we would never ever let an MBA leave our hallway, our building, without knowing. Because if you're going to run a Fortune 500, you better know some principles. Somehow, though, our federal government says, hey, investigator, you've been in the biology lab for 12 years and have never learned any of these things, but I'm going to give you 1.5 million and good luck managing a workforce of, and they know nothing about human resource management, managing the diverse workforce, right? And so all I say is, look, I'm going to take your technical skills and empower you with other skills such that your lab, if you're producing this much and your workers are this motivated, let's talk about some principles to really increase your ability to get even more out of your teams. But again, I want to highlight, the idea of challenges here, right? It's extremely labor intensive. Those good citizens here at Cleveland and in Case Western who are trying to develop teams, running teams, you feel the pain, right? It's hard to get even everyone into one room to have a meeting. It's difficult to figure out when those conflicts come out about, what is it we're trying to do here. It can take time to develop shared language sufficient enough to work together. And training people such that they know how to do this work is also not easy. Administratively, there can be a lot of challenges related to, again, pay, to again, coordination. If you're trying to run clinical trials, that can be challenging. Conflict can arise. And then forget about it when we get to how we decide who gets what role in authorship as we're teaming. There are a lot of sticky issues that arise. So the opportunity cost, of course, as you're deciding to team, I make the comment pretty often, it is the case that our work is changing, but our promotion and tenure system largely still rewards the individual's contribution to the field. And so every time you say, oh, but I really want to work on that cardiovascular disease, I want to go join that interdisciplinary team, you are taking a risk, right? Because you're saying, I'm going to go join a team where I might not get that much credit for what I've just joined to do. But I know it's the way that we're going to make progress. And so every day faculty are in this bind, right? That your career might be in jeopardy engaging in this activity, even though the whole reason that you paid that much for med school or that much for your PhD was to cure X disease, was to make a difference. And so as a management organizations person, part of what I've been doing related to team science is to start a narrative to create some tools where we can say to our academic institutions what corporate has already been doing, which is to say, fine, yes, you need specialization, yes, you need contribution to your field, but you also need to promote the behaviors that allow, that reward, that make it a priority for the investigator to cross the aisle to their colleague in another field and say, you're working on that, I'm working on this, let's get together. But until we change that somewhat, we're not going to get there. So, focusing specifically on teams and team training and development, there are a number of pitfalls that I've already identified, right? Communication, coordination, etc. How do you avoid these pitfalls are, I think it's drawing on team science. Elaine alluded to a science of team science, right? Teams research has been ongoing for 50 years. We know the question I often get is, well, what's the right size of a team, right? We have an answer, right? It's between 7 and 10. That's the optimal number. And I have physicists, I do a lot of work with physicists, a lot of work with other fields, and they go, yeah, but there's hundreds of us on a paper, right? And it is the case. But what I'm saying is you might have multiple, you might have a P grant, you might have a center, but you probably have small units working on one piece of the problem, right? You just can't have that much scope. But we do have 50 years of research that I draw upon, that when I'm writing to my academic papers, that's who I'm writing to. When it comes to what I do in terms of practice at the institutions where I am and when I go to other universities, these are all the different training and education modules that we offer. Everything from how to write a collaborative agreement, how to manage conflict. We do some work on what I call developmental networks, saying that the new translational scholar doesn't have a single mentor but multiple. What's the influence on the way they think and the way it affects their trajectory, right? This is work that if you're interested in any of these, we can talk about it. So let me move into the actual research that I wanted to share today. So these are a number of different kinds of teams that are essentially trying to generate new ideas. A number of scholars have also not only been thinking about teams, but about when does creativity happen? How does it happen? What are the conditions under which it occurs? And a common approach is that creativity, while sometimes it is spontaneous and at random, that it can also be something that is deliberate, right? Creativity can be a choice. We're going to work on this particular problem. But creativity is a product of seemingly unrelated ideas being put in some sort of combination where you get a novel solution, which, and a lot of this work is done in labs, right, with college freshmen. And the correlate, though, in our field would be to say, what happens when you take some algorithm in math or in computer science and apply it to our health records and figure out a problem, right? You're connecting disparate fields and bringing them together, and with that, expertise is combined and you get creativity. For me, and let me step back a bit. So we have a number of ideas about what makes a team really effective, right? But there are some assumptions that fundamentally break when we move from teams as like assembly teams or teams like cockpit teams in planes or army teams, right? And so what are some of those differences when we get to healthcare? One, a lot of times in those settings, you're on one team for a long time. Someone's assigned you to that team. You're told, here's your shared reward. Here's what you all are going to do. You have a lot of time to train together, right? How many of you are on one team and can say your teams have stayed together over the course of your career? None, right? Maybe a few, right? It is also the case that people tend to have the exact same, have enough opportunity to get to know who knows what. But in academic medicine, you're often changing, and you're saying, okay, well, I'm going to work with this group, but I don't know everyone super well. I kind of know them, but not a great deal. So shared understanding, shared goals, shared task experience, these are a lot of the givens in psychology when we say, okay, this is what makes teams work. And so what's interesting to me is to think about, well, how do you take a team, an ad hoc team largely, meaning just formed recently, with where each member has such deep expertise, and facilitate everyone coming to know what one another knows so that they can start to work, right? Especially given a tendency towards action. Meaning, most of the time in academic medicine, it's very rare that a set comes together around a cup of tea and some cookies and say, let's just talk. What do you know? What do you know? And I want to get to know you. Usually we give it 30 minutes. Look, I have time between 1 and 1:30. Sure, let's talk. See you soon. And it's brief. And then it's, hey, let's write the grant, let's get going. Right? So we spend very little time in that planning and get to knowing, and we go right to getting to work. So when we think about collective cognition, we're saying, let's say all of those circles represent expertise that people bring into the room. That is hidden because not everyone can go into your brain and download all your years of education and experience. And somehow that's got to bubble up the individually held knowledge to become something that the team can access so that the team can solve a problem, right? And this is what this team knowledge emergence is. So from my field, we have stages of how this collective cognition forms. And there's some work here on, how is it that we share information. There's a bit on what is the nature of interaction such that we can get more individually held knowledge to be part of a group collective understanding. Now again, a lot of this work has been done with college freshmen on artificial tasks like build a radio. Here's the 12. It's kind of like when I don't know how many of you have kids and you get that like Christmas gift that you're like, how do I put this together? Right, instead that's what's used in the experiment, and you have people working on this intellective task. My question is gosh, what happens when you bring together investigators from, whether it's public health, nutrition, whatever other field you want to think about, and you're all looking at this problem? What is it that after so many years makes you pause and say, how does the way you think about this problem, does that change the way I think? How do you begin to mutually adapt enough so that you find a new space to generate a new idea? In some ways, this is also hard because we have accumulated our own expertise that defines us. That's what our vidas are about. And in some ways, how do you begin to sort of say, all right, I'm going to be open to some alternatives, despite having thought that my ways were the ways. And this is this accommodation, right? As your perspective begins to shift, how do you facilitate those processes so that a scientific team, who again gives 30 minutes to really get to know one another, to become curious enough about one another so that they stick with the problem, given all those coordination, communication, pay challenges? It's not an easy sell to want to stay engaged intellectually in the work. Any questions so far about what I'm talking about or what? And I know I'm taking you to the psychology and org behavior of teams, so I want to make sure everyone is with me so far. Shirley.
I just wanted to make a comment. When I think of the accommodation, I would translate that as a willingness to change your mind.
Absolutely.
You seek the opinions of others, you give your views, and then you're willing to change your mind. I think that's a whole stance one can take.
Yeah.
I like your word accommodation. I've never used that.
Yeah, I think accommodation and assimilation are two terms that I'm going to use. But, and I want to highlight Shirley's point, and I want to bring up her career in particular, right? As a nurse who has interfaced with numerous disciplines, right? It's the question of saying, there's simple questions you can ask, right? Which is, how have you been thinking about this problem? Or what has worked and what hasn't worked? And really listening, right? And these are the soft skills that I would say, the trainings I did yesterday. We start to arm academic faculty with the ability to listen, to be curious, right? Not with what's comfortable, but with what's uncomfortable. And to stick with it sufficiently, right? So, again, here's the model, right? That we have this individual level processing of group information, of what's being shared as you're in a group. You're considering potentially what other people say. Maybe you're integrating it into your current framework, accommodating, assimilating. And at the team level, there's what's visible, right? A group is talking, they're sharing information, and there's a lot of assumptions. The way we study groups often is by, again, videotape or coding conversation. And my own sister, who's a physician herself, is incredibly introverted, right? And so I'm very sympathetic to the fact that, it isn't always that you're saying your idea out loud, even though things are happening here at this deeper level. But management scholars, for the most part, have studied what is observable in group interaction. And that's important because when we think about cognitive processes, largely we've been using things like verbal reports or transcripts, drawing on studies of interaction practices or communication to say it is what you say that suggests what you know. And so there's a bit of conflating behavioral processes with the cognitive. And so the conclusion is that we've ended up with measures that never really capture what knowledge consideration or accommodation or assimilation. And this leads me to the broader question that as I'm going from my field in org behavior out into the team science, all these different CTSAs around the country, is I'm always asked, well, how do you measure this, right? And usually the default is a publication, a patent, right? You're counting these elements. And it isn't easy to say, how do you measure processes and progress as a team is evolving, right? Intuitively, people will say, it's happening in this team. It's exciting, our conversations are great, and it's flat over here, right? They kind of know, they have a sense of, okay, this is a creative team or this isn't. But my job, or what I'm trying to do is to say, can I measure this intellective process of integration and accommodation? And I'm going to show you my attempt to do so, and I would appreciate any feedback possible. So this cognitive integrative capacity index is something that I'm going to show you how I built it. Again, these are the things that I was saying a little while ago, right? This is all of the work that I'm going to show you is completed in teams that were newly formed, right? Interdisciplinary groups where maybe 2 people out of the team knew each other, but they largely had new membership around some new grant proposal. So they don't have a shared problem framework, right? It's not like they all came out of the School of Nursing and have learned the same textbooks and the same approaches, the same methodological, right? They're really different ways of doing work. They don't have a shared identity. And in fact, sometimes I think the identities in the biomedical space are great hindrances. Well, I'm a clinical researcher, I'm a basic researcher, I'm a community researcher. Well, I'm with the patients, I'm not, right? And we have these chasms, right, that help us to say, well, we're not the same. And not only that, we hierarchically rank. Well, that's the real expert, and that's the whatever it might be, right? And so we don't have this, hey, like in the Army, right? When I was talking about the original teams with Army brigades and crew resource management, etc., a lot easier to say, hey team, you're all wearing the same uniform, you're all working on the same, than to come into a room with a bench scientist that's wearing jeans and a t-shirt, a nurse who's got her scrubs on, an academic who just left the classroom who's got a suit. We don't have a shared identity to function off of, right? And the next is this notion that the work is incredibly complex, right? There's not a single person in this room that doesn't have less than 10 years of education working on one single element of a problem. So to figure out how can you get this, it's not that you meet and all of a sudden this depth of expertise is going to be visible and demonstrable to everyone. And so figuring out, well, okay, this is also different than what we studied before. So I'm going to show you relatively quickly my processes of developing new measurement. And again, much of this is it's a little probably going to be very boring for you, but the idea is I want you to see that this, when the CTSC people say, we're doing team science education, we're teaching you team science, that is a question of how do we assess this, how do we test it, how do we intervene, and it's based on research. So the first thing that I did was to think about, we've done the conceptual work on what is knowledge, consideration, and assimilation and accommodation. We went to Amazon's Mechanical Turk. We had 200 participants where we said, look, think about a time when you worked with others who were different from you than your own expertise or area. We had a big set of items, 43 different items in a scale. And eventually we were able to identify a 9-item scale, right? So essentially we're doing exploratory factor analysis. And then in study 2, we move this to an undergraduate sample of individuals who are all in like interdisciplinary courses. And so here's some example of these items. And in fact, so for knowledge consideration, right, we've defined this as the extent to which you're actively considering the inputs of others. So sample items include, I listen to the viewpoints of each team member, even if it is not widely shared by other members. I consider the views of my team members open-mindedly. Knowledge, accommodation, and assimilation. Again, we're getting at this notion of change, right? So new ideas provided by my team members often change my understanding of how to do something. My understanding of my work tasks often change after my team members have shared a different perspective. And again, I wanted to capture, you should not step into an interdisciplinary team where people are different from you exactly the same. You really should be going, that was if the team is, functioning effectively. I just wanted to mention it. So here are some of the results of, just testing these items. You can see this is the results of the Varamax rotation, etc., right? And we see that we do, in fact, have 2 factors with some items for knowledge accommodation and some for knowledge consideration. There is some correlation between these 2 factor structures, meaning they're picking up on something that's probably because they're both intellective types of constructs. So we wanted to replicate this factor structure, so we again went into medical research teams around the country. Luckily with the CTSA, and I'm also the president of the International Network for the Science of Team Science, my access to medical faculty has not been too difficult. So we took this to actual medical research teams along with a number of other items. Because again, in psychology and or behavior, if I'm going to say, look, I'm measuring something that others haven't, I need to say what other measures do we have, and is this sufficiently different or similar to other scales in the literature? So we do have measures of how much are people sharing what they know so that expertise can be brought to bear on the team's joint task. We do have questions about interpersonal conflict, whether or not people are hiding information rather than sharing, right? It's a little bit more covert. And whether or not people, this is a personality difference, are you generally open to experience? This data here from the results suggests that there are some positive and negative relationships to some of those measures, right? So we can see knowledge consideration isn't related to bringing expertise to bear, but it's negatively related to interpersonal conflict, right? There's enough of defending in a way that this is not any of those other measures, but something sufficiently novel. So here's a little bit more exciting work, and I apologize for those of you that were actually in one of these conditions yesterday. So we've been testing this training module where we've randomly assigned teams to these workshops, right, where they're exposed to material that is supposed to enhance the ways that their team members interact, right? And again, I'm operating off, we talk about these phases of teamwork, right? And you have planning phases and then action phases as teams work. Again, I'm operating off the assumption that in biomedical teams, we sort of go, yeah, to the planning phase and go right to let's get to work. And I wanted to say, well, given a small amount of time, can I teach teams to use their time more effectively such that ideas come up and the scientific curious mind that I know all of you have will say, that's interesting, I can't wait till we meet again. But in other times, and I'm assuming that without this intervention, you go into a room, you kind of go, well, that was good. I don't know, kind of interesting, glad to meet you, glad to know you do that work, and you go back to your own office. But can we get them to another level where, like dating, you see a connection, but in this case it's going to be like an intellectual connection of, that's really, really interesting. So we have the randomly assigned condition, and we have a longitudinal study design such that if you take these measures that I just showed you along with some others before the training and then after the training, and they do have control teams that receive no training. Medical faculty being who you all are, nothing's for free. So for those teams, I say, okay, take the survey twice and then I'll train you after, right? And they've been happy with that solution. We do have measures of originality, the degree to which ideas are novel, integrated across fields, from self-report, and then we have some external ratings of some products that have been developed. If you're interested in the training modules, I believe your CTSC is going to make my slides available. But long time ago, I did some observation of the interaction of about 12 teams for about 9 months, where every single team meeting, I listened, I watched, I recorded what was happening during team meetings, transcribed that dialogue, and I had outcome data that allowed me to see, of those teams, which teams performed better. And the outcome data come from external raters, 3 raters, inter-rater, all the things you'd want to know that there's an outcome. And what I found from the coding is the teams that were most innovative, that really moved the needle on their various topics, were those that engaged in these particular principles. Right, the first being, it was really neat, I was talking to Michael Constant yesterday on our walk home from dinner, and he was talking about a PI that he had sort of grown up under, and the way that he was very inclusive in the way that he posed research questions involving a number of different disciplines, a number of different perspectives. And the fact is that you learn ways of doing science, ways of facilitating dialogue that create the likelihood that someone's going to say, I have this idea, or I've been noticing this, or what if we try that? And it's a way that really exceptional investigators know not to lead like, I have a vision, and worker be you, and worker be you, and worker be you, run this through the lab and let me know what you have in 6 months. But rather, hey, we can get somewhere on this problem. What does everyone think? Here's what I've been thinking. How can we do work? It's a very different model, less hierarchical view of science. So it's how you elicit information from one another, how much that's changing the extent to which people are actually saying what they're thinking rather than sitting there quietly afraid of what somebody might think. And then the extent to which people are aware again of who's in the room, of engaging in more ideation. And then lastly, the more that we saw people saying, hey, you do this work and you do this work, have you guys thought about doing this kind of project? Those sorts of behaviors really led to some better results. But again, that work was frequency of behaviors and outcomes. There's no causation, they're just co-occurrence. So I was interested, can I take those best practices and teach them, right? Transfer that knowledge so that other people can access what I saw. So I teach the principles using real-world vignettes, stylized text from those actual meetings in positive and negative forms. I give it, my prior mentor is the developer, he was the creator of Team Steps. I don't know how many of you have gone through that in healthcare, so I know a lot about team training. And it isn't the case that you can give content without a behavioral opportunity to practice the skills. So everybody gets a simulation where they're asked to use the principles of communication. And then I train complete teams, because the idea is if we socially monitor one another, knowing that we all learn these 4 principles, you're less likely to go back to work and have someone start to engage in other behaviors, and someone can say, hey, remember what Maritza said, we're supposed to be doing such and such, right? And you can hope that those social norms of more positive interactions will stick. Again, pre-post measures, knowledge consideration, knowledge accommodation, with some outcome measures. This is a table of the descriptive statistics for you to see. The only one probably that got me a little worried is that team size seems to be correlated with novelty, but it's still not terrible. But here's what I find, and this is what's really promising. So the teams that go through the communication workshop that I provided, we're seeing a higher cognitive integrative index. They're saying, hey, I was in that room and I was considering the ideas that were brought up as we've been working over the last 3 months. It's happening more. They're saying, from that, I'm changing the way I think, right? And I don't see that adaptation in the teams that don't receive the training. Not only that, when I'm is that when we think about development and training, and CTS states are saying, well, what can we use to measure how our teams are doing, that they might consider using these kinds of scales to more accurately assess changes in their teams. Well, let me pause there. Any questions or comments or? Kurt?
Yeah, wow, that's impressive. Just got quickly outside, that's very impressive. I think we're all slaves to our own experience, and what I see your training doing is moving people along on the awareness of the advantages of a team. And people that have had that experience of working on a big, hairy problem that they can't solve themselves, and then they get the big ahas from the team. People have had that experience a few times. They don't want to work any other way, and they're willing to put that upfront investment in the relationship aspect of it instead of just doing the task, which gets you stuck in doing what you're doing now. But people often end up in 2 camps based on their experience. You're providing a way for people that are in the experience of what tends to be structurally valued, which is the narrative of the heroic lone hero. And you're providing a way for them to pay attention to that and move from one camp to the other without having to have 3 or 4 experiences. You're helping that to make that a quicker transition. So we need that kind of intervention, I think, to help move people into that other camp, because most of the problems we're trying to solve are not going to be solved by the narrow reductionist flow. So I think it's really important work.
I appreciate it. Thank you.
Do you see a difference? What's your name? Sorry, I'm Becca Box. I'm at the Center for Child Health and Policy. Do you see a difference between I'm the new team member.
Okay.
So I'm
Okay.
joining
Yeah,
the team that's
yeah.
been.
So I'll make a corollary. Again, you guys know that I said I'm a social worker, and before that in Stanford I did a lot of childhood development. So in some ways, I take a developmental lens on this and argue just like a child has a critical period of development from 18 to 36 months or whatever. In some ways, a lot of my work is thinking there's a critical period in the teen's lifespan that if you intervene early, you're going to see really different process than if you intervene really later, right? And I have since worked with teams that have been ongoing with newcomers, and if anything, I think there has to be just more emphasis on that, getting to know what the new member knows and appreciation for that. The barrier could be when the core contingency is like, hey, we know what we're doing and you're just the new add-on, like hang on, we'll teach you our ways. But, we were talking about this in one of the workshops from the sociology of science and the diffusion of knowledge, and said, well, where does innovation come from? Traditionally, innovation comes from newcomers, and when some idea is crossed over to another field, right? So who are the newcomers, or who are the new fresh ideas, right? It's going to be your postdocs, it's going to be your assistant professor that's testing some new technique. But in that kind of environment, when you have the, hey, we've been working together and you're new, it's ironic, because really what you want to favor is the fresh perspective. Because it could, or your stakeholder, right? It could be what you haven't thought of, right? And I have one comment I want to make about expertise and the kind of expertise we tend to value. As obviously I'm a Chicana, right? Mexican American parent, child of immigrants, and so I'm also very sensitive to what translational science can do for underrepresented communities around, right? So I have a close colleague who is Native American, and she was telling me, she was really frustrated, and she's like, these investigators want to collect hair for samples, right, to be able to test whatever they were going to test. And the investigators like, I don't understand, like, Native American women tend to have such long hair, like, what's the big deal? Like, we just need, like, a little piece. And she's, she's saying to them, you don't understand, hair for hundreds of years, we don't just go to the barbershop and cut it and leave it on the floor so it can get swept up. Like, we burn it, it's ceremony, it's life and rebirth, it's this whole other definition. And so here's this this academic researcher that's got the grant money is going, well, I have a perfect design and I'm going to make a big difference for the Native community. And in that team, there's an expertise gap because while they planned it all out, they never took the time to say, well, where am I doing the work? What is the social context? And what is life really like, right? And so expertise can sometimes come from knowing what things mean to different groups and what life is like and what a certain narrative. And so I want to make sure that when I say diversity of expertise, I also mean, I really mean diversity of expertise, right? And the same module, this communication model, we just made it for community research, right? That is supposed to be much more accessible. I built this to be about disciplinary diversity. But, again, I just want to say, it's not so simple to say, well, we're the ones that have to work. We know academic research, and here's the study. We need those other perspectives.
A practical question. So one of the things you mentioned is that, even if it's an hour and a half, some of it is it's bringing this to the forefront.
Yes.
So what could we do with the CTSA? It strikes me that some of this is a bit of marketing. How do you remind, how long does that sustain?
Yeah.
So in other words, how long are you remembering that the next time you're in the team going, okay,
Yeah.
I need to do, does it wear off very quickly?
Yeah.
And are there boosters that?
Yeah, I have not gone there, but I can think about, especially CTSAs, if you have newsletters, you have, best practices, the same way people, I think there are ways, right, just like those of you who do behavioral modification in public health, right, and say, well, you're saying you're a diabetes patient taking medicine, like what do you do to make sure that, fine, they're good for the 4 weeks after they see you, but what happens in week 11 before, right, if they're not doing, what kinds of things can we do to, like you said, make the treatment last longer? But I don't know, I think probably about, I think it's mutual reinforcement, like team members somehow making this a part of their day-to-day. But it's a good question. All right, so the second training that I presented yesterday is the complement to this idea of, well, it matters how we interact that is going to improve our performance. And the second training really says, well, what is the structure of our interaction? How is it that we actually connect? And so what I do in the second training is basically present a team design exercise where groups come together, and in these teams, they are asked to think about, well, what is it that they are there to do? Curiously enough, where all the teams are newly formed, I probably had about half that are seeking funding. They're getting ready to write a grant proposal, and about half who just got funded. The funny thing about it is both groups equally benefit, because it's very rare that even after a proposal is in, the teams have really sat down to say, so what are we really doing now that we have the money? But I want to give one example. I recently did a strategic planning exercise at the University of Southern California. They have a big cancer center. They did a workshop. They wanted to talk about where they could go around cancer survivorship. And in the room, there were a number of investigators. And this first phase, not administrators, but the sort of executives that were at the helm of this effort, they in their mind were like, okay, this is what cancer survivorship is. This phase should be really fast, and we're going to get to some other work. Long story short, we start this dialogue about cancer survivorship, and we can't get past what are we here to do, right? Because it meant a lot of different things. There were a number of obstetricians in the room who were like, cancer survivorship is what does it mean for fertility? When a young woman gets cancer at 13, 14, 15, do we need to be thinking about saving eggs and fertility, right? There were mental health people in the room saying the depression for this population is really much higher because they're always at the hospital. Every time their immune system is compromised forever. It's a hard life. So they're saying survivorship is about wellness, mental health, right? So you can imagine it. You go through a number of different specialties, and the exact same, what are we here to do, is really, really different. And so this exercise, though, of saying, well, what is our joint work, what is our vision, is one that I just want to encourage that every time you have a new initiative, every time you're going to kick off a problem, trying to bring people together around, what are we here to do? Why does that matter as a team member? That someone would have said, how come you're here and what are you interested in? What does that matter for the short term, the medium term, and the long term as you're actually doing the work? What do you all think?
You have to see yourself in it.
That's exactly right. You need to. This is not, again, in a corporation. Your partner can say, the five of you, you're assigned for the next 6 months to go work with, 3M, right, to do work, and you're assigned. Academic medicine, you have the intellectual autonomy to pick and choose what you want to work on. So that act of saying, hey, what does everyone want to do? It allows everyone to say, I'm really interested in a new diagnostics because I'm really struggling in the clinic and I want to make it to work. It allows someone else to say, but you know what's getting me up in the morning? I want to do such and such. So as you're crafting that work, you're able to find something that's of mutual interest. What does that help you to avoid? As a PI, it helps you to avoid 2 months later when you're going, hey, I thought you were on the grant, your biosketch is here, how come you're not doing the work? And you're going, well, I wasn't really that into it. I just thought it gets a little more money, all I gotta do is forward my biosketch and a paragraph. It wasn't a true investment in my time, right? But that meeting also allows people to say, hey, actually this isn't going in the direction I want, and I'm gonna go ahead and leave. There's a lot here that is accomplished. So you're able to motivate joint effort. You're able to say, how is everyone going to work together? You usually have them map out what are some sub-projects they're going to do, who would take the project, who would take the lead on different phases. They're allowed to think about coordination across, again, different kinds of data, different clinics, different access, right? Sometimes projects get very, very hairy. People never really sit down and say, how are we going to coordinate? When it's work that's going from basic to trial, you never even, it allows you to say, well, what is our proof of concept? What has to be study number one? And then then what would be study number 2, right? And different people have different criteria about what those might be. So taken together, they get an hour or so to map this out. I wish I could say in an hour they solve it. Most of the time teams just start a conversation, but it gets them moving in the right direction. Usually people take pictures of these boards or they take the actual board with them and continue to dialogue. These effects, while they look small, are all significant. A couple of things pop up as they engage in this activity. Very first, remember I talked about how you need to know who knows what to be able to, it's like cooking. You need to know what ingredients you have to figure out what are we going to do. People get a better sense of who's around the table as they engage in this activity. They're able to make connections between one another more more easily. When they're thinking about what work should we do, it inherently elicits ideas about how the work can be approached. People gain what I call transdisciplinary orientation and collaboration skills. And then again, we're seeing that when people are in this mapping exercise compared to the control, they're more innovative. Their work is more it's fresh and original. So those 2 modules, this is part of this NSF funding, but I did want to move us just for a second here towards this idea of measurement, right? Again, just to wrap it up, we do have a series of resources if you or your teams or other teams here in the CPSA, this is part of the science of team science if anyone is interested. I had a slide that I was going to put up. If you're interested in seeing the tool, the toolkit that we're building to help people to write their statement and their promotion and tenure packet about how they're teaming. Again, your vita still needs to say, hey, I've done this work and I'm an expert in this area. But if you also want a narrative that says, but because I've been here, I've been critical for this initiative, and it wouldn't have happened had I not been here to team, right? And so I do have something there to help as well. So, in conclusion, the last thing I want to say is that if you're curious about this topic and you want to learn more about it, we have an annual conference. It'll be in Lansing, Michigan at Michigan State University. We come together for a couple of days. We usually have representation from all of the federal agencies, NCI, NIH, NSF. They are increasingly asking for team science or management plan statements. So it's good to learn about, well, how do I write this into my proposal? Or how can I, and there are lots of practitioners there wanting to learn, and if you're interested in just learning, how can I do this better? There are workshops available to either learn how to lead a team or to be in a team. And if you can't go, send a postdoc, send someone else. It's a really nice conference. So with that, thank you very much for your time.
We have a little bit of time, but let's stick around for questions.
Is your flight? Just point of clarification. Sure. The modules you talk about, they're an hour and a half in length, and they're basically
They are. Yeah.
people do that.
Yeah. The NCAPS is actually paid myself and a couple other colleagues to make video modules of some of them. So we're hoping to launch those in May, but they're not yet. And then the other training modules you saw that are those are about an hour long. And those are just like, I think it's equivalent, surely, of the team science course that you offer, but in practice modules. Because, I do have one certificate course, but they're really like, I get that faculty and postdocs don't have a lot of time. So it's how can we be there at lunch with the KL2s, or how can we go to this department and give a 1-hour workshop. So they've become this like a la carte tapas, team science sort of deal. And that allows us to get the word out.
When there are many people who speak different languages, and at least a few don't speak the other language, usually there is an interpreter who knows ideally all the languages in the room. On a truly diverse biomedical health team, describe the interpreter.
Yeah, well, I will first say that in that planning exercise you saw, we didn't get to it as much yesterday, but I usually have them identify where there would be gaps, right? So don't know, maybe you have a linguist that's going to translate materials and intellectual distance. So usually I have them identify where they think those trouble spots might be, and then think about in their team who could span that difference, right? So it could be a lot of things, right? So if you know you're doing community work in the African American community, and you know that the research team includes someone who is a PhD that's part of the team, but who's also African American, for me that might be, let's ask so-and-so to interface because of trust and whatnot. On an intellectual level, it might be the PhD or the MD or whoever, the nurse, whose minor was computer science, but who's a biologist, and you know you're about to do some work in artificial intelligence, and so that requires you knowing, again, mapping it out, realizing that there are those touch points, those conflict areas, potential conflict areas, and then going, who could we put there? Rather than later on going, oh boy, this just fell apart, why didn't we see it? So, and sometimes you need to hire someone. You need to be like, we need someone that can do this. And my lab, this is like 3 giveaways, right? The clinical coordinators, the pharmacists, the biostatisticians, people who often PIs go, they're, last to be thought about. They really should. When I do these trainings, I say bring your lab manager, bring your program up, bring whoever that you think is critical, who is really thinking about how things work. And again, I think your more skilled PIs understand that work is done through not just the ivory tower elite in their groups, but everything, right? And so making sure that everyone has access to be a part of the team is just really, really critical.
As a biostatistician, I just want to be I believe my career is so I understand for the process, but there's time to I wish the others, they was downstream events when it finished everything. But as a she said, most times she will tell you why you started that order.
Right.
Wait, so I really appreciate this kind of idea. There's a long way for us.
Absolutely, right? So that's exactly right.
That is the piece.
Yeah, definitely. I have a close relationship with one of the head biostatisticians at UCLA, and really sometimes he's one of my primary referral. Like he refers people to me for coaching or for help because he can also pick up on this team just really doesn't know what they want to do because one PI is calling and saying, well, this is this analysis, and the other's going, no, that's not the analysis. We're really going to. And to figure your problem out first, and then come to me with what you want to do. But that's where he says, look, they could use some assistance, right? Yeah. So, but again, it's this idea that recognizing the team is much more broad than just your colleagues.
What's your experience with dealing with the institutional needs for control and credit, and then how that filters down to people's individual activities?
Yeah.
But really emphasizing the larger environment.
That's a great question. So the chancellor at UC Irvine and the provost have just sponsored, they've just funded me and 3 other colleagues to do work around this. If you're not aware, right, when a grant is awarded, even if you're a co-I, like a co-PI, only the primary on the grant, from the institution's perspective, is really given credit. It's where the money went. Whose account did that money go into? And so there's a lot of questions about, and then of course deans are saying, well, this is how much money my faculty brought, even if the grant was brought in across departments, and it can actually hinder the exact cross-disciplinary interaction that I think leads to some cures and some treatments and interventions. So what we just did at UC Irvine was a bit of a cost-sharing plan where we recommended a new way of thinking about how to divide up the credit, even if it's not the fiscal credit, but to at least make sure that we provide a report to every dean that actually says here is the participation and a bit of a point system so that you could, because how many of you have been on projects where yes, your PI got money, but you've been working your behind doc and you're really the one underneath or otherwise they'd be in the shadows. And so we have been doing this work. I just had an email yesterday with the head of our CAP, which is our promotion and tenure. They wanted me to talk again about initiatives around a new dialogue in teen science. The slide that I did put up has a nice publication by Holly Falk, Professor Brzezinski, and Julie Klein, talking about the trends in promotion and tenure nationwide. My sense is that institutions will be behind the curve if they ignore the way that work is really getting done. I am not ignorant enough to think that you can completely unravel the way that tenure promote, nor would I want to. The only reason you're invited to an interdisciplinary table is because you have depth of expertise and specialization in your domain. But to be disincentivized from meeting someone else whose ideas could really get you to a nice solution because they're in another department, because they're in another school, that's problematic for me. So all I think is we acknowledge that people are teaming. Some people are particularly skilled at good university citizens that are elevating institutions to do what they're supposed to, just to solve society's problems. So I would, say, look at that paper. It's a private institution, much easier to move than my system. I'm embedded in 7 UCs, and then, right, it's a lot harder to do policy change. But Pace West, USC, and University of Southern California is probably at the lead. They do have a tenure statement about team science. It's fabulous. So, but yeah, I think many of you who are senior here, I know your strategic plan is about to expire. Now's the time to say, hey, what does this mean for this element of future planning? Don't give up if you're teaming and it's hard. There are several books. I can send some citations, HBR articles on managing conflict, women in science. I can send a bunch of sort of practitioner type things if you'd like to see those. You can just maybe read to click on to get some additional how-tos. If you can let Elaine or Hannah know, and I can try to just filter you some helpful tips. Thank you, everyone.
This is really wonderful. I just wanted the last things to say is just to remind everybody that this is a part of our PRC seminar series, which is monthly. On January 9th, back at the PRC Enterprise at noon, we will be having Jacqueline Curtis, who is a spatial GIS person, who's going to be giving a talk, it's actually a faculty talk, a job talk about the work that she does in spatial analysis. So we invite you all to January 9th. Thank you all for coming, and happy holidays.